Hello, I'm Kate Marie from the Slow Aging channel, and I'm here today with Dr John Flynn, who's a very innovative cosmetic doctor from the Gold Coast. Hello, John.
Hello, how are you, Kate Marie?
I'm really good. So tell me about stem cell facelifts.
There's actually quite a lot of things to really think about and to talk about, and it's probably best to put it in the context of what we might call a traditional facelift, which is a surgical procedure. Now, with such a surgical procedure, you're looking to lift and reposition tissues. However, with a stem cell facelift, it doesn't lift and reposition. What it's designed to do is to try and improve the texture and the quality of your skin. So commonly, we may use the stem cell approach in association with a surgical approach because they really do quite different things. When we age, there are three basic elements that occur. We have descent of tissue and sagging of tissue, and the surgery is designed to fix that really quite well. There are other skin tightening measures, but primarily the surgery is the gold standard for that element. But the other thing that changes with aging is the volumes that we see in our face. We often, lose volume in some areas and gain volume in other areas. And so redistributing the volume is an important element with an anti-aging concept of facelifting. And the third element is the texture and the quality of the skin. Now that's affected certainly by age, but also by lifestyle, how much time you spend out in the sun, whether you're a smoker, and all those other sorts of issues. And the key element with the stem cell approach is those non-surgical elements, the volume redistribution and the skin texture and quality issues that cannot be addressed by surgery alone. And so I think in essence that's the way to think about the positioning of the stem cell facelift.
Well, doctors for decades have been doing what's known as autologous fat graft.
Correct.
Or injections. So, and I've done a little bit of research and I've noticed that some of the doctors say they're doing stem cell facelifts, but they're being accused of really just doing an autologous fat injection or graft. So what is the difference with the handling of the tissue?
Again, it comes down to something of a nuanced argument, because the repository of most of our adult stem cells as we grow older is actually in fatty tissue. And so on the one hand, you could argue that if you take fat from one area, say the stomach, and put it into the cheeks, that you're transferring the stem cells that are within the natural fat. However, that really doesn't pass muster when you're really talking about a stem cell facelift. Really what should be happening is, what we should be talking about is that we're enhancing the stem cell population in whatever fat we inject. But it's important to understand that you don't always have to inject fat. You may inject the stem cells alone without the fat component. The fat component is there to try and address those volume issues we talked about before. And if you enhance the fat with an increased population of stem cells, then there is evidence to show that it will last better, and the graft, because that's what it is, it's a graft, will take better. Now, to achieve this, what you've got to do is you've got to draw fat from your tummy in excess of what you might need from a volume perspective. You would then segregate the amount that you feel that you need to correct volume, and the remainder of that fat needs to go through a laboratory processing to take all of the stem cells out of that fat. Now, if you then add that enhanced population of stem cells to your original volume element, well, that is more correctly deemed a stem cell enhanced fat transfer. Now, having said that, if volume is not required, but we're looking only at skin texture and quality, then you can inject the stem cells without the fat. Now, in such a circumstance, you would harvest the fat, you'd go through the laboratory processing, isolate the cells only, and then having isolated the cells, you then inject throughout the areas of the face. But what you're aiming to do there is to change skin texture and quality. So it's important to remember skin texture and quality, volume, and sagging. and there are different elements that are required to redress those things.
I've spoken to a few different people around stem cells, experts supposedly, and the stem cell harvesting type companies are claiming that not all the doctors are getting viable stem cells after their harvesting procedures.
Unfortunately, that is correct, and there's been a fairly large legal action in the United States with a particular company whereby it was shown that they were delivering dead cells or non-viable cells through their production method. Now, unfortunately, that particular production method is in place in other countries as well, including Australia, and so I think it is accurate to say that there's potential for non-viable cell delivery at the end of certain processes. Now, clearly I can't go into specific cases. A lot of companies produce their product in a different way, but it is fair to say that there are some methods of stem cell production that leave a lot to be desired. It's important also to recall that once you harvest the fat and you remove the adipose tissue or the fat element of the tissue, you are then left with what we call a mixed population of cells, and that is referred to as stromal vascular fraction. Now, within that stromal vascular fraction, there is only a small percentage of those cells that are actually true stem cells. There's lots of other types of cells as well, and so some would argue that a stromal vascular fraction is not truly stem cells. However, in common usage, in common language usage, that stromal vascular fraction is taken to mean a stem cell population.
How do you know if they're viable? Like when you harvest the cells, how do you know the cells are viable before you put them back in?
Well, this is actually a very important element, and it comes down to whether or not cell collection is monitored by the human eye and human processes, or whether it's automated. There is clear evidence that automated cell counts exaggerate the number of cells, and an automated cell count can't be reliably relied on to differentiate between a cell that is viable and a cell that is not viable. However, in the more orthodox approach to cellular culturing and to cellular medicine, there are ways of telling whether a cell is viable or not, but the reason that it's not universally used is that it's labour intensive and it requires the human element, and it requires time. And so in some circumstances, different production methods are designed to cut the time, but unfortunately they have a tendency to cutting the viability and the accuracy of their cells.
So does that mean they actually, with a human element you're talking about, they're actually getting a microscope and just doing checks?
Yeah, there are ways that you can tell, and there are tests that you can perform that'll show you whether or not cells are viable or not. And of course, you need to count the viable cells. There's no point in counting dead cells. They have no function.
In terms of stem cells and putting them back into the face, does it cause, I know you're saying it affects texture and other things, does it cause actual regeneration then of the cells that are in the face? Does it have some sort of ripple effect?
I think that's a good way of describing things, because there are some misconceptions about what stem cells are designed to do. And the very simplistic view is that the cell itself will differentiate into another type of cell. And in some ways that indeed does happen. But I think the other very important element is to understand that the stem cells actually act as signalling cells, and they signal other tissues to respond in a certain way. And I think it's that combined element that really puts the value into a stem cell procedure.
So with the signalling, is it similar? That's similar then in the way PRP or platelet-rich plasma would work?
That is indeed true, except that you're talking about a cell population rather than a plasma or a serum.
When you wanted to do the procedure on me, So can you explain just briefly how you'll do it and how will I look?
We identify the area for the patient that we're going to harvest the cells, and most typically that's around the abdomen or the upper part of the buttocks. That's where most of us carry some excess fat. Now the average patient, their perception is that there's far more fat than there really is available, and there's most commonly less available than most of us realise. And one of the elements of facial aging is that if we're very slender in build, then that tends to be reflected in the face, and some people feel as though they may have some gaunt features. Now, that is the stimulus for them having the regenerative procedure. But of course, the reason that they may feel as though they look gaunt is because they actually don't have a lot of excessive fat cells. If somebody is overweight, then that's reflected in their face as well, and perversely it gives a better sort of anti-aging effect. Now, having said that, in a more slender person, we often need to fight to find the fat, and as I said, there's generally less there than most patients appreciate. But we only need a relatively small quantity of fat to produce the stem cells. And the majority of times we can achieve that through a little bit of light sedation and some local anaesthetic. We call that tumescent anaesthetic. And having harvested the fat, the patient then is free to go home, and we send the harvest directly to the laboratory. Now the laboratory will then separate out the cellular elements and the fatty elements, and we really don't need the fat. That gets discarded because it's the cells that we're really looking for. Now it usually takes some weeks for us to prepare the cellular product, because one of the things that's very important is that we need to make sure that it hasn't been contaminated, that there's no infection or bugs hiding in the tissue. And of course, when we do those sorts of cultures, then it takes some days for the culture to come back and tell us that it's free and it's a good uncontaminated specimen. Now, having reached that point, we can then inject the stem cells. Now, depending on what our aim is, whether it's to do a stem cell facelift, whether it's to enhance a fat graft, or perhaps inject into an arthritic joint, the same cells would be used. And so we would then make the second appointment for that injection episode. In regard to the stem cell facelift, we're looking primarily to skin texture and quality. The cells are prepared in a small volume and usually mixed with a bit of PRP, because the cells are in a concentrated plug of tissue, and so it needs to be resuspended. And if we resuspend it in some PRP, then that gives us a good product to inject. And so you would inject in multiple places across the face, and at the end of that procedure, yes, there'll be some little bits of pinpoint bleeding because of the multiple needle injections, but that will settle within moments. The patient would look a bit red, look a little bit spotty for a few days, but beyond that there should not be any downtime at all.
With the procedure you're doing on me, are you addressing all three of the issues? Because I know I've got very gaunt and I'm sagging a bit here. So what will you...
Well, again, the answer to that question is basically to give you a mirror, and you have a look in the mirror and you tell me what it is that you're wanting to address.
Yeah.
Now, the stem cell approach is not going to lift and reposition, so it's important to understand that. We're looking at replacing volume, and we're looking at improving skin texture and skin quality. Now, most patients who feel as though they need some extra volume in their face, it's usually because they've lost a bit of volume just underneath the eyes, around the cheekbones. Some people feel as though they're a little bit hollow underneath the cheekbone and looking a bit gaunt, and the other area is in the temple. And so all of those areas can be a site of injection of the stem cells. If volume is required, then we will add the stem cells to a fat transfer. If volume is not required, we would use the cells alone.
Once the stem cells are injected, how do you know that they're taking or they're working? Are there any sort of markers?
There are some markers that you can employ, but they do require a bit of sophistication in the laboratory, and they're not of practical use. They're of use in a research sense, but not in a practical day-to-day sense. The most visible sign that the process is working is, again, you're looking in the mirror and you can see the improvements in the texture, you can see the changes in the volume. A lot of times also the result is in the feel of the skin. And often we feel the skin, it might feel rough and dry and scaly, or we feel that it's sort of soft, crepey and crackly. And then after the treatment, you can tell that it's really soft, it's plump, it's got better turgor, and I think that's a good term. It's got a better turgor feel to it.
How long before the procedure has an impact?
You'll have an impact within a matter of 2 or 3 days, because what you'll see initially is an inflammatory response, which will give you some swelling or edema. And that edema will be seen as a positive volume response, and it also indicates a better fluid content within the skin itself. Now, over the course of probably about 2 weeks, some of that will actually fade and the result will go down a little bit, but then it'll pick up again as the cells, which are tiny little metabolic engines, they gear up and start to produce the vitamins, the physiological factors that the cells do to keep your skin healthy.
Does it have a longevity? Like, how long does the impact last?
Well, one of the things, that's one of the things that we just simply don't know, because we haven't really been doing this for long enough to be able to tell. Now, the stem cell facelift approach has probably only been in place for maybe 18 months or so. Fat transfers, on the other hand, have been around for quite a number of years. And we know that if we do just a straight fat transfer from one place to another, provided the graft takes in the first instance, we should get a longevity of somewhere between 5 and 8 years in the life of the fat. And we know from that the fat itself does change the texture of the skin overlying the area, and that's a good thing. So if we build our expectations sort of from that premise, I would think that the result of the stem cell addition should at the very least be the same as the fat transfer, so 5 to 8 years, very likely to be actually longer. But we won't really know that until we've had a longer period of time to study these things.
Is it a painful procedure?
No, it shouldn't be painful. Certainly not the harvest, because there's lots of local anaesthetic used, and the anaesthetic is very slowly absorbed, so it'll have an analgesic effect for many, many hours after the procedure. The injection process, well, it'll be a little bit stingy because there's lots of little needles, and you probably feel that the skin is just slightly tender, as if you've had a very firm microdermabrasion or something or other like that, or a very strong exfoliation, but it really shouldn't be any more so than that. If you're going to get an exaggerated result in the early stages, it's probably more related just simply to swelling and possibly some bruising, because some people, their skin is far more reactive than for other people, and some people bruise more than others. So they're the sort of the short-term things that you're more likely to see.
And in terms of aftercare, what's required for aftercare?
No, you follow your normal hygiene routine. You look after your skin the way you would normally do. There's nothing special needed there. Preferably don't smoke, don't walk in front of a bus, all of those sorts of things.
So have you had any side effects? Like, is there any signals that you should return for an early consult? Or
the biggest potential problem from the treatment stage is excessive bruising or excessive swelling. And if you notice any of those things, then clearly they need to be addressed. In a lot of occasions, though, it's just simply being aware that that's an issue and nursing through the problem. Whenever you're injecting anything into a patient, you have to be careful about potential infections, but that would be a very rare occurrence with this type of thing.
So I'm not going to, with the stem cell, I won't grow an extra nose?
No, you won't grow an extra nose. You have to be content with the one you have.
Because, you know, you hear these things around stem cells where they can develop into, well, you see, I've seen where they've done experiments and you create a new heart and a new other things. So I think there's a lot of people don't understand this stuff.
Well, there's a big difference between experimental stem cell work and practical and therapeutic stem cell work. And there's a big sort of gap between those two. When you see laboratory experiments like that, they're very artificial environment, and generally you've got some sort of an organic scaffold on which to build the cells, whereas we're not talking about that in this circumstance. The other thing too is that remember that a lot of the early work was done with embryonic stem cells, and they have a far greater potential to differentiate than do adult stem cells, and they really are quite a different type of cell. One of the problems with the embryonic stem cells is that they are too good at differentiating, whereas the adult stem cells are not so good. Now, counterintuitively, that's actually a good thing because you don't want to grow your extra nose or anything like that. So unless you had a organic scaffold to seed the cells into, that's just simply not going to happen.
Yeah, because maybe in the future you'll see you could stick in a scaffold to lift your face, or...
Yeah, that's certainly a possibility in the future. We're not quite there yet, but all of the researchers are looking at exactly those sorts of things.
I'm not sure whether you're aware, there's been an inquest into the death of an elderly woman who underwent liposuction for stem cell harvesting, apparently, to be used in treatment of dementia. And it's hitting the media at the moment.
Right. Look, I'm not aware of that specific case. Certainly there's some theoretical discussion about whether or not stem cells may help dementia, but I'm not aware of any trials in that area, and I'm not aware of any strong evidence that's shown that that's been the case. Clearly that would be a very good area to research, but that type of research really has to be conducted under very rigorous circumstances. In regard to the patient's demise, do we know whether it was related to the liposuction? Do we know whether it was related to the stem cells, or was there some other condition that the patient had? I'm not aware of the specifics of the case.
Yeah. What about getting girlfriends as donors? Has there been any research done on donated fat cell?
Well, you can donate them to yourself.
Yeah, you can, but what if you can't grow enough, if you haven't got enough?
Well, but the issue there is that you've got to understand that your cells contain a unique signal, a unique feature, and if you put your cells into somebody else, they will mount an immune response and they will fight off those cells, so you'll have a tissue rejection. Now, for a long time we've been able to get away with that with blood transfusions and those sorts of things, but you do have to type the blood to make sure that it is compatible between donor and recipient. Now that's an even more difficult issue when you're talking about fat, and so I don't think in the foreseeable future that we'll get to the stage where one individual may be able to donate to another. It remains to be seen.
Thank you, John, for joining us.
Thank you, it's my pleasure.